Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community. And today I have the pleasure of speaking with Dr. Kaylee Honeywood, an anesthesiologist and palliative care physician at Vernon Jubilee Hospital. Welcome.
Thank you.
So tell me a little bit about what your day-to-day work is like.
It's quite varied, which is kind of fun. I have, on the weeks that I'm covering on palliative care, we have some patients that are enrolled in our hospice at home program, which is an exciting program that has been initiated by the North Okanagan Hospice Society as a one-year pilot project. So we have several patients in the community that we would see and follow up with their nursing team about concerns that they have, discuss the concerns with the patient and their family to make their end of life at home as comfortable as possible.
And so you're an anesthesiologist as well. So I guess I always think anesthesiology surgery versus palliative care is home care. How do the two mix?
Yeah, so the transition between anesthesiology and palliative care is actually a lot more intuitive than it sounds, because a lot of the medications that we use and the symptoms that we manage are the same. So when I give an anesthetic, I'm tending to use pain medications, and I use some sedative medications to control things like pain, shortness of breath. I use medications to control nausea and vomiting. And these are much the same as the symptoms that our patients who are experiencing life-limiting illnesses also experience. So the transition between the two is actually not quite as strange as it sounds.
So when you think palliative care, you typically think terminal illnesses like cancer or even some things like Parkinson's and those types of things. But a lot of folks are living at home with Alzheimer's or dementia. How does that fit into the whole scope of palliative care?
Right, so palliative care is really the control of symptoms of people with life-limiting illness. So if you consider that as someone living at home with Alzheimer's dementia or another type of dementia, they're experiencing symptoms often that require control for them to have the best quality of life they can have in the time that they're living. And this is the same for anybody with any life-limiting disease. We all experience symptoms from time to time, and there are certain people who have heart disease, people who have respiratory disease, people with cancer, neurological diseases, all sorts of things that anything that causes someone's life to be limited by that disease deserves to have symptom management and care so that they can have the best quality of life in the time they have left.
And so are many of the people that you see dealing with things like cancer, or are they dealing with things like Alzheimer's, dementia, neurological diseases?
I would say that the majority of the people that we see, particularly through our hospice program, are end-of-life patients, which is different from just palliative care, because palliative care extends the entire spectrum of disease. But the most common things that we see are people suffering with cancer, and there are some people suffering with neurologic diseases, and we see occasionally people who are living with Alzheimer's dementia, but more commonly, I think those people are cared for in the long-term care facilities.
And so what's the benefit of palliative care at home versus going to hospice?
Some people really want to die at home, and their family wants them to be at home. And if there's a way to facilitate that, that is an incredible gift, I think. We've gotten very medicalized when it comes to death. And historically, we used to die at home, and our families took care of us. And that doesn't happen anymore. We've moved death into hospitals and long-term care facilities, where a lot of people, I think, if given the choice, would prefer to die at home. So Hospice House here in Vernon has taken a great initiative. They've fundraised locally to be able to finance this pilot project, to be able to give people that opportunity and try and make that more the norm compared to moving death out of the home.
So if somebody goes into hospice, what's typically their length of stay there?
So in order to qualify for a hospice stay, a patient needs to have a life expectancy of 3 months or less. Some people stay a little bit longer, a lot of people stay a lot less time. I think that as we get better at recognizing when people are nearing their end of life, that we will get better at having people stay in hospice for a longer period of time. I think the things that break my heart the most is when people want to be transferred to hospice and they pass away within 24 hours of arriving. But because you just know that they could have had a level of care that would have given them more attention and comfort in the end of their life. So I think that as the whole system gets better at identifying these people who are very near to their end of life, then we give them that best opportunity to have more time in a controlled, lovely, peaceful environment with the symptom control that they deserve.
As a physician, how hard is it to be dealing with people at the end of life on a regular basis?
I actually find it the most gratifying part of what I do. As you can imagine, being an anesthesiologist, most of my patients aren't talking to me. So they're usually unconscious. But I really love the ability to sit down at someone's bedside and have a conversation about what matters the most to them and their family. So I actually find those interactions really rewarding for me personally. And I hope that it brings peace to the patients that I deal with. So I very frequently have people see me to the door after visiting their loved one saying, "Oh, I don't know how you do this job. This must be the hardest job in the world." And I love it. I think it's just so rewarding, and it's such a gift to be welcomed into someone's life when they're talking about the end of their life.
I was speaking with Dr. Kaylee Honeywood, an anesthesiologist and palliative care physician at Vernon Jubilee Hospital. Stay tuned for the next episode of Docs of Vernon, which will be airing tomorrow. I'm your host, Sharon Hughes-Geeky. Thanks for joining.